Hi, my name's Manoj, Krishna, and today I want to tell a story of a 47-year-old lady who presented with 26 years of back pain before I saw her. The MRI scan showed disc degeneration at L45 and L5S1, the bottom two discs in the spine. She tried and failed all the conservative options. This is a cross section showing a disc bulge on the left side at L45. She had a bit of leg pain as well. So we treated her with surgery in the form of a posterior lumbar antibody fusion at L45 and L5S1 with an interspinous spacer at L34. We take out the two discs, pack them with bone, which are filled inside these hollow cages, and then put some screws and rods in the spine. Here's Alison telling her own story. Alison, good morning.
Morning.
Okay. Love your accent. Which part of the world is that from?
I'm from Glasgow.
Glasgow. Okay, and how old are you?
I'm 47.
47. And you've had back pain on and off for 26 years, you said.
I have, yeah.
Do you remember how it started?
I don't know exactly what happened. I just remember being a student and having to take time off from my course and was very debilitated and couldn't walk for a few weeks.
Okay, and then since then it's just come and gone?
It was sporadic, so it would come and then it would maybe a year later it would come back and it would be there for a couple of weeks. And then it eventually started to get closer and closer together so that the pain was there constantly.
Constantly. And how did it affect your quality of life?
There were lots of things that I couldn't do. There were long periods of time that I couldn't work.
What sort of work do you do?
Well, at the moment I'm an occupational therapy assistant.
Okay.
When I was a student I didn't do that. I've always worked in the NHS.
Okay.
I've also been a personal trainer and I had to stop doing that because of the back pain.
Okay.
I used to run a lot and I had to stop running because I couldn't run with my clients. So it has affected
every aspect of your life.
Absolutely, yeah.
And I think you found me by accident. Your chiropractor recommended me.
Yeah, Elaine recommended that I come to see you. That would probably have been about 3 years ago.
Okay.
And it took me a long time to finally decide to go for surgery. But we had injections before then.
We did some facet injections.
Yeah.
All of which helped short
They
term.
did, absolutely, yeah.
Were you quite anxious about the prospect of surgery?
No, I was absolutely thrilled at the idea of it. Couldn't wait to get it done.
Okay. So talk me through the surgery now. It's 3 months ago. Talk me through the surgery, your stay in hospital, and then your recovery afterwards, please.
I came in on the Friday morning for my surgery, and I was discharged on the Sunday, maybe about 11 o'clock. Immediately after surgery, I had lunch and felt absolutely fine. The first night, I didn't sleep particularly well. The second night, I was maybe a bit more disturbed. On the Saturday morning, that was the morning after surgery, I was out of bed and walking, and when my husband and my son came to visit, I walked along the corridor to meet them, which was lovely.
Okay. And then you went home on Sunday?
Yeah, absolutely fine.
So you're 3 months from surgery. So how are you now?
Fantastic, absolutely fantastic. I'm back at swimming. I'm now walking the dogs for long walks.
How far do you walk?
Probably about 2 miles.
Okay.
I think I probably could walk further if I had the time, but that's as far as I go. And my husband and I started ballroom dancing, and we're dancing twice a week, which is great.
Fantastic. And what about your pre-op pain that you've had for 26 years? Is that still there?
Oh no, it's gone.
How much pain do you have?
Occasionally, if I do too much, or a wee bit enthusiastic, it's a niggle more than anything. What I find sometimes is that there are muscles in other parts of my back that are starting to get a bit tight.
Okay.
But I see my chiropractor on a regular basis, and she says that my back is the best that it's ever been.
And I think the rest of the niggles will settle in the next few months. So, and what about painkillers?
I'm not on any painkillers at all.
Fantastic. I mean, I think to have had 26 years of pain and then for it to go away after surgery is, even I'm really thrilled with that.
Yeah.
So.
It's transformed my life. Fantastic.
Thank you.